We have a question from engineer Mohammed Noor. He's asking about, you just mentioned that there was a lot of money invested by governments and went in vain. So he's asking for clarification on that.
Yeah, so the one that I was referring to is the famous NHS project that targeted on a single EMR for the entire UK. But if you although maybe that's not even a good example, but take another example is meaningful use in the US. You may probably have heard, which was part of Obamacare, the incentive to digitize healthcare, which in a way was a huge success because when it started, everything was paper. But it digitized most of the hospitals in the US, Obamacare, meaningful use, the incentives there. But in the end, Congress noticed that it didn't really achieve interoperability. So everyone had their EMR, but it still was impossible to exchange data. So if you, as a patient, would move from hospital A in city B to hospital D in city C, you couldn't get your file, which was very frustrating because they spent, I think, $30 billion or something in those incentives. And in the end, now what you're seeing now with the ONC final rule, the 21st Century Act is in fact, I think, a way to repair that omission.
You gave me another great segue for my next picture.
Okay, great.
I'm not able to surprise you at all in this webinar so far. My next picture is something that we might consider ancient technology, but is worth talking about. I remember the very first time my dad parked the car as a kid and watching him go, speak to a machine in the wall and come back with money, and I was like, wow. And so this makes me think of interoperability too. This to me is like the best example of interoperability, right? We have financial data that is owned by a certain bank, but it really is like, I do feel, an ATM makes me feel like I own my account. Now, this technology may make us feel happy or sad, depending on what number we see in there. But this idea that I can go to any ATM in Egypt, regardless of who I'm banking with, and get some money. And of course, okay, if it's not my bank, then I pay a fee. But also when I come and visit you in Amsterdam, I can use an ATM in Amsterdam and get that data. And I really want to ask you, how since you're like integrated with that work, how far away are we of having a similar thing for healthcare, where I go to, in a pharmacy or in a clinic, and I immediately pull my clinical records, pull my labs, and give them to the doctor. And while I have you think of that, I want to launch our second poll real quick, just to get a feel of where people, what people think of when, and this is to the audience. So if you're not looking at your screen, please let us know what you think about your own healthcare data. Now, this question is specifically about healthcare data, right? So do you feel that you have ownership on your own healthcare data? And Rien, before we go into like the actual question, like how about you tell us your answer to that poll. Do you feel like you own your own healthcare data in any way in the Netherlands?
Well, no, well, partly. There you go. I don't own it. I can view the data that is shared by my hospital, although I must admit that I rarely do. Yeah, I can. My hospital is an Epic hospital, and I think I have my chart, so I can log into my file, and I can retrieve a lot of data actually. Really? That doesn't mean I own it. I'm not sure if I would want to own my health data. It's entirely different, by the way, than the data that I own, which is more like wellness data that I own on my phone, right? My steps and heartbeat, etc. That's a different story. But my medical record, I don't own it.
It seems like, yeah, most people feel the same way. We have a whooping 76% of people don't think that they own that data.
Yeah,
And
actually, it's a pity. You should ask a second question. Is it a bad thing? Are you, you know, does it bother you?
Well, I mean, from let's think about the positive aspect of it. If you do own that data, then and at least when I'm asking that question, I'm thinking when I go to a doctor, or when I have done, let's say, surgery 5 years ago, and I'm seeing a primary care doc, I do want him to know, or her to see my labs, at least like the past couple of months, if I have done them. And another positive aspect is that I don't have to pay for multiple things, right? In the US, like 1 out of every 3 Medicare beneficiaries have a CT scan, for example. Whether they need it or not, I might have done a CT scan 2 weeks ago, but now I'm in a different state and different hospital, and they're like, whoop, we're going to test you again. So it does save money, I think, to own the data, even if you're not monetizing it per se. But I'm back to my ATM analogy. Like, do you think we're getting closer to there? Like, and it's hard to ask you that question because you might be biased because that's what you do on a daily basis. But have you seen much progress since you went into the market until now? Is it hopeful?
Yeah, there is progress, but it's very slow. But you have to keep in mind that in healthcare everything's very slow, and that's not a reproach. It's happily so, because healthcare is, it's in the end, it's about your health, and it's a matter of life and death. So it tends to be a conservative industry, and it is so in principle and by nature. So I know there's a lot of entrepreneurs here in the audience. So being a startup in healthcare it takes a lot of patience. If your horizon is 3 to 5 years to achieve your goal in healthcare, being an innovative health startup, that's pretty ambitious. Because in healthcare, everything goes at a slow pace, and so is interoperability. Do we make progress? Yes, we do. And I think that FHIR is very important to the progress that we are making. But even with FHIR, which is the best we've had so far in healthcare, I'm convinced. But even so, it will take a lot of time to achieve a higher level of interoperability. Also, like I mentioned before, it's not a thing that you can achieve for the full 100%. It's a more or less thing. You can have more or you can have less, but you can't have it all. And we don't need to have it all.